Let's talk about all this with UW Health's Chief Quality Officer, Dr. Jeff Pothof. Thanks for being with us again today.
Good to see both of you.
Let's start with the mandate. Do you think this was warranted?
I think we're getting into that, position. We started to see cases go up a few weeks ago. We started to see hospitalizations go up, and that trend isn't necessarily reversing. And a year and a half into the pandemic, we know what works. And what works is everyone masking, especially in high-risk situations, i.e. indoors. And because this variant is so much more contagious, we have to act quicker than we would have before to keep that slope from going up even higher. So probably not a bad idea to say, you know what, we need to tap the brakes. We got to get those masks on indoors and see how this Delta variant plays out over the next couple of weeks.
And at the same time, the Biden administration is expected to recommend, maybe even as soon as tomorrow, that many Americans, not just immunocompromised Americans, get a booster shot, a third shot, if you're 8 months after being fully vaccinated. Why is that being recommended?
I think it's being recommended because we're seeing more breakthrough cases. And, before Delta, that wouldn't have mattered that much because we didn't have breakthrough cases. People who are vaccinated couldn't really transmit the disease. With Delta, that's changed. So if we give a third shot to folks who've already been immunized, that'll increase their antibody level, and it should decrease the rate that we see breakthrough cases or vaccinated people that then go on and transmit to the unvaccinated. And that might help us, bring down case numbers. That might get us back to a situation where we wouldn't have to wear masks. If we can eliminate those breakthrough cases in vaccinated people.
And you should stick with the same vaccine that you got originally.
For right now, I think that's going to be the recommendation. I wouldn't be surprised at some point in the future when we understand more that the Moderna and Pfizer vaccines might be more interchangeable. But based on what we know right now, I'd say stick with whatever you got before.
Well, what is the guidance if you got the single-dose Johnson & Johnson vaccine?
So right now there isn't guidance just because they don't have good data. What I think you might find is because the mRNA vaccines are performing at a little bit better rate against the Delta variant, you might see guidance that suggests people who got single-dose Johnson & Johnson at some point, whether it's 8 months or maybe longer, go on and get an mRNA vaccine to better protect them against the variants that we know about right now.
A lot of people who got COVID early on think that their immunity is going to hold up, but that's not necessarily the case.
No, I'd say most studies would suggest that natural immunity against COVID, lasts at least probably 6 months. The problem there is that a lot of these variants that we've been talking about for months now are really good at evading natural immunity, and Delta is one of them. So if you had COVID, way back when, you're likely not very well protected against Delta variant. You could get sick again.
So give the shot.
Yeah, it's always best to get vaccinated. That's the way to get the best protection against this Delta variant, which really is, causing a lot of trouble for us.
Well, we're talking about people getting a third shot. At the same time, public health officials are trying to convince a lot of people to get their first shot. So which is more important?
Yeah, if you put them on a scale, I think the impact of not being vaccinated at all exceeds the benefit that we get from a third shot from a booster. So if you're not vaccinated at all, you've got no protection. You're not guaranteed to stay out of the hospital. You're not guaranteed to have your life spared if you get COVID-19. So, still the focus needs to be on getting those who are unvaccinated vaccinated. If we want to, not have mask mandates and not have these other restrictions, the number one thing we can do is get as many people as possible vaccinated. That's how this goes away.
What's the situation right now at UW Hospital?
So we are seeing higher volumes of patients with COVID-19, which makes sense with the increased cases. Now, with that said, we're still able to manage them within our special pathogens unit just by doing some airflow changes and things like that. We haven't yet had to look at alternative staffing models or turning down some elective or non-urgent, non-emergent procedures at this point. And we hope that remains to be the case, as we start to head into fall, that we can manage this pandemic without having to take those kind of drastic efforts.
That's good to hear. A lot of people are getting a little discouraged, though, and feel like I got vaccinated so I wouldn't have to wear a mask all the time.
Yeah, to them I say the vaccine's still 100% recommended. And the reason why is if you're vaccinated, you can stop worrying about severe disease and death. COVID-19 is not likely to land you in the hospital. It's not going to kill you. Now, things changed with Delta. It's possible you might get mild symptoms or you might just be a spreader. But far and away, there is tremendous reassurance in the idea that I'm vaccinated. I don't have to worry about being hospitalized or dying from COVID-19. That's just a tremendous, reassuring thing for a lot of people.
It is a relief. All right, Doctor, we'll see you next week, I guess.
Don't go far.
Mask up in Dane County starting Thursday.
Dr. Pothof, thanks for your time. Great to see you.